Dr. Jennifer West here with Furbaby Doc. We are covering vet dates or can it wait? So just some topics of things that people frequently call in and ask about of is this an emergency or is it something that can wait for a regular veterinary appointment? To start, we'll cover eyes. If your pet is squinting, pawing or rubbing their face, has eye discharge that isn't just a little bit of clear but yellow, green, something that's unusual, you should go to a veterinarian. Some of the easy things it could be would be there's just a little bit of something in their eye, but if that stays in there, it could cause an abrasion, an ulcer. It could be high eye pressure or glaucoma. It could indicate another systemic illness that's going on with them. But the sooner you address an eye issue, the better for the prognosis of that eye, to prevent vision loss, and also just improve comfort for your pets. Do your best before, if you need a little time to get to the vet, to try to put an e-collar or a cone on so that they can't rub or scratch the eye. Even if it isn't a foreign object in there or a scratch, they could cause a scratch, an ulcer, and that is a bad eye issue. Now, other things will include, for questions that people ask on should they come into the vet, is not eating. If a pet skips one meal, probably not a huge deal. So, they might not be hungry, there might be something going on causing some stomach upset. In dogs, I recommend trying a bland diet. If they don't have any known allergies, trying things like some chicken or turkey with no seasoning. It's easy to even just boil it, or you do canned chicken. Just be careful with the sodium content, and some rice. If you're worried about vomiting or upper GI issues with not eating, white rice can be helpful. Lower GI issues, sometimes brown rice or even a little bit of canned pumpkin can help with high fiber content. Now, if a pet's going many days without, or a couple days without eating, and a cat even 24 hours, can become a concern. They break down fats quickly and can develop a condition called fatty liver or hepatic lipidosis. And young animals, kittens, puppies, they can't go very long without eating. They really need nutrients, so those are cases where it may become an emergency. If on the other end, your pet is not pooping, may or may not be an emergency. If they are still eating, if they are not straining, then it's probably okay. I have owners that say, my dog goes to the bathroom every day at 8 a.m. and 3 p.m. or whatever that schedule is, and it can be alarming to see they're off their schedule. But some of the common reasons may be that they just had an anesthesia. So anesthesia medications will slow down motility. And so as long as they're still eating, food's coming in, it's going to come out. It's just slowed down a little bit, but there can be other processes going on, inflammation, or other things causing a slowed down motility. If they ate something that isn't food, that might be scraping things up. Again, if they stop eating, they start vomiting, or they're straining to poop, that is an emergency. Otherwise, stick it out, keep an eye on them. Torn toenail. I will admit, I actually just experienced this with my own dog, but usually when a torn toenail comes into the ER, we kind of giggle. It tends to be something that could have waited, that we could have tried some things at home first, but sometimes it just bleeds and bleeds, and it's so frustrating because your dog licks and chews and you can't get it to stop. Ways to try to prepare to prevent that include getting a product like Quick Stop. It comes in little vials. It's this powdery substance, usually yellow, and you can place that on their quick, the area that's bleeding, and apply some pressure. That usually will stop the bleed. Just try to prevent them from licking at the area, distract them for a while, allow that to stop bleeding. Sometimes pets do need a cone or an e-collar if they really won't stop going at the spot. But typically it's while it looks like so much blood and it's really frustrating, they typically do not lose a true large volume of blood through a little toenail bleed. Trouble breathing. Trouble breathing is one that you do not want to wait. If you notice your pet having effort, so their chest and abdomen are moving with their breathing, or you hear a weird noise, in cats, a really important thing to know is they are obligate nasal breathers. They're like horses, domestic cats. And so if they have any obstruction or inflammation, like a rhinitis, if they have an upper airway infection, they are probably not going to eat. They will prioritize breathing over eating. And so that's really common for cats to stop eating, and you say, you know what, they've been having some eye or nose discharge, and realize they probably had an upper respiratory infection. If you ever see a cat breathing with their mouth open, they're not a lion, they're not a tiger, they're in distress, and you should go to the vet right away. Coughing. Coughing really depends as far as emergent, level. Sometimes pets develop coughs due to a heart issue, a lower airway breathing issue. It could be more of like a bronchitis or pneumonia versus an upper airway irritant. If there was just one or two coughs, I would probably just monitor. But if that is something that's going along with breathing effort, or you're noticing any concerns, just go in and have it evaluated. So I will finish up with, let's see here, itchy ears. So similar to our nail issue, ears are one that can likely wait to your regular veterinarian. But sometimes pets are in a decent bit of discomfort. So an ear infection versus another issue going on with their ear, they're scratching at it, they're whining, they're rubbing the ear, they may stop eating if it's getting to be that uncomfortable. So they may need to be addressed. Sometimes they do need an e-collar or a cone to prevent them from causing further trauma. And it's common for dogs to scratch so much that they develop a hematoma, an oral hematoma, which is a big blood clot. So their ear flap gets really fat because there's blood. The tiny little vessels are ruptured and they bleed into their ear flap. Common allergies can show up that way with dogs. They like to get itchy ears, itchy skin, hot spots, which is just moist dermatitis, a little area that's red, irritated, some fur loss, it smells, it's infected. They'll lick at it. So any of those kinds of issues, if they're still eating, breathing well, drinking, acting normally, but have that kind of issue, if you can keep a cone on them and get to the vet, in the next day or so, that should be okay. Whenever in doubt, number one thing is call your veterinarian. Don't listen to YouTube, don't listen to Google. Focus on your pet and speak with your veterinarian directly. These are just guidelines, just ways to help you be prepared before you're in this crisis, so that hopefully you have some more knowledge and some more empowerment to figure things out. But again, rely on those professionals, reach out about your personal pet, and make sure that this applies to them.